Well, welcome everyone. I think we'll go ahead and get started. We may have some more folks join us as we proceed, and that's fine. My name is Jay Otto, and I'm a researcher with the Center for Health and Safety Culture at Montana State University. And this afternoon, we're just going to engage in a brief webinar about looking at workplaces and how we might maybe expand or augment or maybe even change our thinking about the role of workplaces in efforts to improve health and safety. This webinar will be recorded, and so if you want to listen to parts of it again or you want to share it with others, we will send out information about access to the link. It'll be available through our website. Take us about a day or so to put it up on the website, but it will be available, so know that you could watch it again or share it with others if you wanted to. You also have, as a part of your WebEx, a chat window and I think a question and answer window as well. So you can feel free to send in questions or chat questions throughout. We've got some other members of our staff who are keeping an eye on that. They can maybe answer some of those things as they come up quickly. And then also we'll have some chats at the end where I'll look at those and see if we can address those questions that come in. So before we get into the topic, I just want to give you a little bit of background and context about the Center for Health and Safety Culture. We are a recognized research center at Montana State University, and our work is about understanding how culture, shared values, attitudes, and beliefs influences health and safety. And that's obviously a very broad topic. We take a very interdisciplinary approach. We have staff with a wide variety of backgrounds. We also think it's extremely important to bring our findings out to community and do work with community. All of our research is sponsored by agencies and organizations seeking to move the needle on real issues in the areas that they serve. So we do projects for federal, state, and community sponsors. And we really don't do any of that kind of research where you do odd things to college students and then publish a paper about it. All of our work is very applied. It's really working on very specific issues that folks are trying to make where folks are trying to make a difference. We primarily work in three or four broad areas. About a third of our work, or a little bit more, is traffic safety, which is why we're housed in the Western Transportation Institute. But we also do a lot of work on, and historically have done a lot of work on, the misuse of substances. And we're starting to do more work around aspects of violence, interpersonal violence, domestic violence, as well as child maltreatment and child well-being. And of course, we know these issues are interrelated. They overlap a lot. We also, you all may recognize that together, these are the major contributing factors to years of potential life lost. So these are very critical public health issues. And our research is really looking at how can we start to look at approaches to these and really underlying a process to these that can really transcend the different issues. So we like working on different issues and seeing how federal and state and local partners address them similarly and differently. And then really how can we start to look across these. Today we're going to really focus on workplaces. And I want to begin with just a short little it's almost like a little joke or a story to illuminate, and the pun is intended, the topic for today. And basically the story goes, there's a woman walking down the street. It's at night. It's kind of dark. And she sees a man who's crawling around on the ground under this streetlight. And she stops and says, can I help you? What's going on? And he says, I've lost my keys. So she begins to help him and start looking around and looking through the grass and the other things. And then after a few minutes, she pauses and she asks him, so where did you lose your keys? And he said, over there where it's dark. And she kind of looks quizzically and says, well, why don't we look over there where you think you lost them? And he says, well, the light's better here. And I think sometimes historically in efforts to improve health and safety, we can sometimes work where we think the light is better, where it's easier to see things, where it's easier to reach folks. And so throughout this presentation, I want to try to just expand our thinking about that and push ourselves to think about new places and new ways. Now, I know many of the folks who on the call maybe have also, already are doing extensive work in workplaces, and that's great. But I think it's just that notion of being able to start to expand our thinking. So I'd like to begin with a quick assessment. This is an opportunity for you to rate your own workplace. So if you're an independent contractor, well, then you have a workplace. It's you might be in charge of it solely, but you have a workplace, or if you work with an organization. So what I'd like you to do is I'd like you to look at this assessment, and for each item that is a yes, I'd like you to add 1 to your score. So just keep a cumulative score, go down the list, and for each item that is a 1, add 1 to your score. And if it's a no, don't add anything to your score. If you don't know, it's a 0 as well. So look through. Does your workplace have an active seatbelt policy, an impaired driving policy, a distracted driving policy, a fatigued driving policy, a drug use policy, an alcohol use policy, a tobacco policy, and a harassment policy? So tally up your score. Next, we've got some additional ones. This is very much, does your workplace routinely, in other words, not they've done it once, but that they're routinely doing this. Assess and develop plans to address workplace satisfaction, workplace stress, workload, work-non-work balance, command and control management styles, worker flexibility in location and timing of work, and conflict management skills. So again, add 1 more. You're keeping this cumulative score, just add 1 more for each of those. Next round, does your workplace have programs to support preventive health care, healthy diets, exercise, active commuting, that could be walking, biking, and tobacco cessation programs? So keep your score. We've got 1 more. And then finally, does your workplace implement policies and practices to employ workers with physical or mental disabilities? All right, so now what I'd like you to do is take your final score, and I'm going to open up a poll. And so you should be seeing a little panel that opened up, and you can put your total score on that question. So were you 0 to 4? Were you 5 to 9? 10 to 14, 15 to 19, or 20 or more? So go ahead and click in. Look around your screen. That little polling panel should appear somewhere, and click in your response. I see a number of folks who've started, so this is great. We've got about 40% of you have finished. Keep on going. Keep looking for that poll. Okay, good. We got some more folks. Just got a few more minutes to try to get your numbers in. We're up to about 53% have completed it. So just click on the response for you. This is where we have the elevator music going on in the background. Everybody, any more click in? All right. So I'm going to go ahead and close it out there. And then I'm going to share the results. So you should be able to see the results. So we had about 36 out of 60 of you responded. We had maybe one person had a low score of around 0 to 4. A number of you had a score of 5 to 9. Even more, 10 to 14. Few folks, 15 to 19. Good number. And very few folks at 20 or more. So it just gives us a quick sense and a way to check in about a wide variety of ways that workplaces could potentially engage in different aspects of health and safety and sort of where we are with our own organizations. So we'll keep that in mind and we'll come back and talk about that more as we go on. But I just wanted you to connect with some of those ideas just as we get started. So what I really want to cover today and talk about is recognizing that I think workplaces are a tremendous opportunity. So I want to spend a little bit of time about why we think they're an opportunity, provide some definitions of healthy workplaces. These are definitions which various forms of government have developed. Look at some workplace-based interventions and really looking at some opportunities there. And then also talking about some future opportunities with some exciting ideas where we can connect the dots between health and safety as well as other issues that are very salient to workplaces. So before diving into that, I think it's valuable for us just to spend a time and I want to raise an idea called the fundamental attribution error. And this is a psychological phenomenon. It's something that all of us are subject to. It's a psychological phenomenon that's characteristic of everyone. And it basically says that when we interpret other people's behaviors, which if we're working on health and safety issues, we probably do all the time. We're trying to figure out why do people do what they do? Why don't they engage in more health and safe behaviors? But we often tend to overestimate the role of their individual characteristics or their character or their traits. And we tend to underestimate the role of their situations. So why does this matter? Well, this can lead us, this error, especially in the prevention field, can lead us to draw some inappropriate, I think, conclusions or strategies about how we address our work. And one of the things that I see is that folks can get into a place where they want to have an inoculation theory to prevention or an inoculation theory to improving health and safety, where the idea is if I can just sort of inoculate people or fix people so that they get it, then they will carry that through their lifetime. And so I think this is one reason that we can fall into a place where we heavily focus on children to improve health and safety. So we have this inoculation idea is if I can just get the kids to understand the dangers and harms of drugs, then they'll be good for life. Or if I can get them to wear their seatbelts at a young age, establish that habit, they'll keep it for life. And while I think that's partially very true, we have to be careful of not overestimating their character or trait and underestimating the environments in which they exist. And so I absolutely think we need to address children and work with schools and efforts to improve and establish safe, healthy beliefs and behaviors. I think we don't want to allow the fundamental attribution error for us to dismiss working with adults. And so recognizing that even through our best efforts of inoculating children with healthy and safe beliefs and behaviors, if they grow up into environments where risky behaviors are prevalent or protective behaviors are reduced, they may be more likely to engage in those behaviors and in essence lose some of the inoculation that we created with youth. And so it's not that we don't want to work with children, it's the recognition that we also need to work with adults. If we think about our work through the lens of a social ecology, that individuals exist in nested relationships, that we need to work across the social ecology to comprehensively improve health and safety and thereby influence the culture, we can recognize that workplaces are a great opportunity. They exist sort of in these layers between higher level systems like community, states, and nation, and more personal levels like family, peers, and individuals. So the workplaces provide us an opportunity to reach adults and thereby can extend both directions, where by working with workplaces, we can then have them take it home and influence their family and peers and individuals, and we can have it expand out to start to influence the behaviors of communities and states. When we just simply look at the population of the United States, we can see that a significant portion of adults are employed. It's about 4 out of 10. And that's more than what we would see in terms of school-age children. So as we just think about it as an opportunity to reach adults, workplaces become an opportunity where we can really reach a lot of adults. That's not to say we want to ignore adults out of the workforce or, as I said, children, but it's just recognizing the opportunity that does exist. When we think about sort of schools versus workplaces, I think many of us in the prevention field are used to many reasons why we might work in a school environment. We can review those. We know that children can learn and often learn better than adults. Their brains are more pliable or plastic. They readily absorb information, and that's very true. We can have extended interaction with children in schools. If we have multiple sessions in a curricula we need to bring to them, schools are a great opportunity because they're there, 180 plus days a year for many hours a day. So we've got this extended interaction opportunity. We also know that health impacts academic performance. So improving health is very salient to the school system's mission of teaching children, and that if children are unhealthy, they're less likely to learn. So it's very connected to the core functions of schools. We also know that public schools have an obligation to teach the whole person, that it's not just about teaching algebra, reading, writing, and arithmetic, but we want students to develop core skills that they can use throughout their life, including skills about their own health and safety. And we know that students will absolutely take improved health skills home. So we know that students who talk about, let's say, tobacco safety will bring that home and talk to their parents about that, and that can be an influence on the rest of the family. But I think it's also interesting just to think about this through the lens of workplaces. Sometimes we lose sight of the fact, but adults can learn too. What I always like to ask is, I imagine virtually everybody on this webinar is an adult, and simply, hypothetically speaking, raise your hand if as an adult you've learned something in the past year. Well, of course, everybody's hand is going up. So overwhelmingly, adults can learn too. We don't want to lose that fact and think it's only children who can learn. Workplaces provide extended interaction with adults. We have an opportunity to do more complex training or multi-session training or refresher trainings with adults all the time through workplaces. Health impacts business performance. We're going to look at some specific numbers about that. But we know that if employees are healthier, they're going to be at the workplace more often, they're going to be engaged more, they're less distracted. So it absolutely impacts business performance. We also know that workplaces do have an obligation to serve the whole community. And many workplaces recognize this and embrace this. They sponsor activities outside of their core mission. They encourage employees to volunteer in their communities. So they recognize they're a part of the whole community, and improving the health and safety of their employees is a way that, and having their employees take that home is a way to serve their community. And absolutely, adults will take skills and knowledge that they learn in the workplace and bring it home, and we can't forget that. So we want to think through those lenses as well. So I think all the arguments that we might use and have used historically to bring health and safety efforts into schools can also be used to bring it into workplaces. And we just don't want to lose sight of that. If we look at the hard costs are significant. If we just look at these three areas, motor vehicle incidents, substance use disorders, and workplace violence. Together, they account for a tremendous cost to workplaces. This can be direct cost in terms of employee absences, but also costs through health insurance, regular liability insurance, repairs and damage to equipment, lawsuits, all sorts of things. So on average, the annual cost per worker for these issues is about $2,000 a year. So that's a significant expense. So as I was thinking about that, I work for Montana State University. Montana State University has about 3,300 employees. So that equates to about over $6.5 million per year. Now, the university does not get one bill for that, or even 3 bills for that. That gets spread out across a whole lot of different costs. So it can be difficult for an organization or a business to account for that cost or to accurately measure directly that cost. But it's definitely there, and I think it's something that we need to talk to our workplaces about. If we strategically think about how can we improve the profitability of workplaces, the ability of workplaces to grow profits for their shareholders, but also increase salaries and benefits for their employees, reducing costs associated with these is definitely a critical area to look at. And certainly large businesses have recognized this and invested significantly to address some of these costs, in particular around health insurance costs. We can also start thinking about other dimensions of workplaces that make them great opportunities. Workplaces have a culture, without a doubt, whether it's intentionally created or just created by absence. Strong workplaces actively cultivate their culture. They heavily focus on what are their values, what is their purpose, and they do training on that and cultivate that. That creates a great opportunity for us to leverage a strong culture to address health and safety related behaviors. So it's just a great opportunity to leverage strong culture. Workplaces also, like schools, provide an opportunity to cost effectively communicate with employees. Communication is expensive. Mass media campaigns are very expensive, and the mass media world is very competitive. So we hear so many different messages from so many different sources that they can be drowned out. But workplaces can provide a very targeted mechanism and very cost effectively. It could be through email. It could be through printed materials. It could be through interactive training. But all of those mechanisms provide cost-effective ways to directly communicate one-to-many for very focused audiences. Also, workplaces are a great opportunity to explore ideas around safety citizenship. This is an area we're very excited about at the center. Carrie Finley on our team is doing a lot of work on this. She's recorded some webinars on this. And safety citizenship is this whole idea where I'm going to move beyond just focusing on my own safety within the workplace, but I'm really going to actively promote pro-social safety behaviors where I, as an individual, I'm thinking about not only my safety, but the safety of others. And I'm going to empower people to speak up. And this becomes very important, especially around safety behaviors where the majority of folks are engaging in safe behaviors, but it's a small portion of the population who's not. And we really think a key opportunity is to empower that large portion of the population who gets it to actively communicate and address the behaviors of the small portion that doesn't. And this is very salient for issues like seatbelt use, occupant protection, impaired driving, violence, substance use disorders, all sorts of issues where we can leverage a large portion of the population become more active to help out and address the safety issues of a smaller portion. And safety and workplaces just are a great opportunity to do safety citizenship because it's a very, again, a strong culture. We can provide the training on it. We can establish expectations about it. And it's where safety citizenship came from. Safety citizenship was developed in high-risk workplaces. So it's just a great opportunity. So that was a little bit of background as to why workplaces, I think, are a very interesting opportunity and reasons that we can leverage them. Now I want to explore some definitions of healthy workplaces, which I think can take us to another level about the role of workplaces. The World Health Organization has established this definition. And I'll just read it very quickly, but a healthy workplace is one in which workers and managers collaborate to use a continual improvement process to protect and promote the health, safety, and well-being of workers and the sustainability of the workplace by considering the following based on identified needs. So they want to look at the health and safety concerns in the physical work environment. So that's, first and foremost, is our workplace safe, just in terms of interacting with equipment and other systems. But also, we want to look at the health, safety, and well-being concerns in the psychosocial work environment, including how we organize our work and our workplace culture. This is around issues of stress, work-life balance, all sorts of things there. Also, do we provide and look at personal health resources in the workplaces? If this is where people are many hours in the day, can they easily access the personal health resources they need by co-locating or making it very readily accessible? And then how do we participate in the community to improve the health and safety of workers, their families, and other members of the community, recognizing that healthy workers and healthy citizens will be able to support the workplace in terms of buying their products, using their services, but also provide future employees. So I think this is a very comprehensive definition. If you work on health and safety, you can see the themes there that they're recognizing this work is about a continual improvement process. It's not about a program or a strategy. It's about engaging in a process. That's much like we see the work of prevention is very much engaging in a process. But what a strong definition of a healthy workplace. Canada, I think similarly, has built on the World Health Organization and recognizing that healthy workplaces require a combination of healthy employees, healthy organizations, and that we have to think about both of those together. And really, I think we probably get some ideas around healthy employees, but what does it mean to be a healthy organization? And how do we very intentionally create that? And they've created a framework around where we're going to look at protecting the physical work environment. That was very similar to what we saw with the World Health Organization definition. We're going to make accessing personal health resources easy. We're going to look at supporting psychosocial work environments, that it's beyond just physical safety, but we have to think about good social and emotional safety and health, and that we need to move beyond our walls and involve the communities. And this is going to require leadership engagement, and worker involvement, and that we want to do this in the context of ethics and values. So I think their approach is very similar to the World Health Organization, and I think that's been out for several years, but they're continually doing more and more work to embrace that. I think in the U.S. and aspects of the European Union, we're a bit behind. I think as a governmental approach, we still look at this work through risk management. It's much more reactive than proactive. And we're really, if you sort of look at OSHA and other guidelines, it's really around the identification and reduction of risk, as opposed to also recognizing the importance of growing protective behaviors. So I think we have some work to do. We need to move beyond just reacting and responding to incidents. And I know many workplaces do. They're more proactive in that. But I think we have to look at some of those other dimensions of healthy work environments, healthy communities, and just a more proactive approach. But we're certainly not there as a nation yet. And I think that's manifested in, our health outcomes. The United States does not lead the world in healthy traffic safety. There are many, many other nations that have better traffic safety performance than the United States, as well as on substance use disorders, addressing violence and child well-being and child maltreatment. So the United States has a lot of work to do here. And I think we have a lot of work to do in terms of our understanding of the workplace and its role. We can also start thinking about aspects of workplace-based interventions and some of the data. just to get a sense of some of the trends, this is relatively recent data. It's 2006 to 2016. The line at the top are around a rate of fatal workplace injuries around self-employed individuals. And then the orange is all workers, and the green is those who are more wage and salary workers. We can see that self-employed workers might be higher. This might be higher risk industries, for example, like logging. I used to live in West Virginia, a lot of self-employed folks in logging, and logging is extremely dangerous. But we can see some of the trends that overall were kind of flat. Maybe we had some slight reductions there in 08, 09, and 10, but maybe that was also representative of the recession. But overall, performance is kind of flat. And if we had to put a trend around self-employed, it might be increasing. So we're not seeing a lot of improvements here, and definitely a lot of opportunity for improvement. If we look at some of the major sources of fatal occupational injuries in 2016, transportation incidents are way up there. So roadway incidents and other transportation-related incidents, this could be also on rail and systems like that, is a major portion. We can also see that violence is a major factor. I think the vast majority of that is around violence between people, but in certain industries that may also include around with animals. Then we look at sort of occupational ones around terms of falls, slips, and trips. We can also look at contact with objects and equipment. This can be all sorts of heavy industry equipment and things like that. We can also look at toxic environments, and then fires and explosions. So certainly when we think about traffic safety in the broad context, we also need to think about traffic safety through the lens of workplace, and a huge opportunity, but also there with violence. And of course, this doesn't call out the role of the misuse of substances, but the misuse of substances could be complicating factors for all of these. We know as somebody who is operating equipment or engaging in other activities under the influence, they're much more likely to have an injury or a fatal injury on the workplace. So that's a complicating factor to all of these. I think it's good to call out an organization which does some great work around this, and that's the National Safety Council. So they have a mission which specifically focuses on addressing improved health and safety in a variety of contexts, but one for sure is the workplace. So organizations can join the National Safety Council, get a lot of resources from them, and they absolutely do provide tools and resources for workplaces to address these issues for around best practices on traffic safety policy and things like that. But really, there are not a whole lot of interventions and evidence-based strategies that come to bear. We see a lot more of those existing in the context of youth and children, but I think a lot of opportunity for us to do more work there. Now, we've engaged in some efforts and projects around this. Several years ago, we were involved in a project in Canada, in Ontario, and they were looking at reducing workplace driving incidents. They recognized that was a leading source of issues and health and safety in Canada. And so we engaged in a project that looked at these 6 areas of risky workplace driving. And so we worked with 3 organizations, 14 sites, and we wanted to sort of understand where they were in addressing these issues. These are the top 6 contributing factors to workplace motor vehicle incidents. So we wanted to see amongst these organizations what was going on. What we found in terms of doing some survey work with employees was most of them recognized that they did have workplace policies around these issues, although you can see there's still a significant portion of the population who did not know. And, if you don't know about a policy, that's sort of equivalent of not having one from the perspective of the individual. So we recognized that there was definitely work that the organizations needed to do about bolstering the knowledge of these policies. We were also doing work with them about how to promote bystander engagement to get supervisors to talk more about these policies, to hold their employees accountable to these policies, and getting employees to speak up with their peers on those. It was a short project. We were not able to, the funding was not sustained through a change in sort of high-level provincial leadership, but it allowed us to begin this conversation about looking through the lens of workplaces and how do they talk about safety, citizenship, and even just basic awareness of policies within the organizations. I think the organizations that we worked with were somewhat surprised at the significant portion of their employees who did not know these policies existed. Several years ago, and I know we got some folks on the phone from Utah, but we did a survey in 4 rural counties of Utah, and we specifically asked, this was a random sample survey of adults through random mail. We wanted to know, were they aware of, or did their workplace have a seatbelt policy? And what you can see is about a third said yes, about a third said no, or I don't know, and then about a third, were not in the work environment. But that means, a third of the population was in a work environment, but either did not have a policy or did not know. So a tremendous opportunity to address a very basic behavior like wearing a seatbelt by bolstering that in the workplace environment. And those coordinators in those counties are really working on this issue. And we tried to create some tools to help facilitate that, where they could work with workplaces and give them examples and guidance and really promote that. We looked at, this was a convenience sample, but it was a large sample of adults throughout Minnesota. We are doing some work there. And we asked about, do they have a policy about never driving after drinking? And only about a quarter said yes. About half said either no or I don't know. And a quarter were not in the workplace. So huge opportunity there. And similar numbers when we looked at sort of their texting. Do they have policies around never reading or typing on a cell phone while driving? So just a tremendous opportunity for workplaces to address very high-risk behaviors. We don't know if these workplaces actually do have policies or don't. That wasn't a part of this research study, so we weren't able to answer that question. But still, we can see just tremendous opportunities. This was some work that we're doing in Idaho around distracted driving. And here we looked at 5 different distracted driving behaviors. We wanted to move on just besides just like texting. But you can see very few folks in Idaho were indicating that their workplace had a policy. The blue are the individuals who said yes. The red are individuals who said no. And then you can imagine a box above the red, and those would be the individuals who are not in a workplace. So you can see just huge numbers of folks who are not having clarity from their workplace about potentially distracted driving behaviors. And we know that cell phone use and technology use is a major source of distraction, but it is by no means the only source. And eating is another one, and certainly attending children. And many workplaces aren't in an environment where they'd have children in the back. But still, these are other very distracting behaviors, and whether folks need to be talking more actively about that. So Idaho's engaged in a project where they're working with some workplaces to really try to establish clarity on these and address the growth of these behaviors from a traffic safety standpoint. And Idaho Power in Idaho is a major partner. Idaho Power wants to address these issues with their employees, but they also want to address this issue broader because they're the ones who have to go out and put the power poles back up when folks are distracted and leave the roadway and hit their power poles. And they're also extremely concerned about the health and safety, but it's also just a financial concern for them as well. So those are, not a lot of examples of workplace-based interventions because there needs to be more work on those, but really showing some of the gaps that we have in terms of opportunities and the lack of policies. Now I want to explore, I think, some exciting future opportunities to look at this issue. And this is really looking through the lens of emotional intelligence, also called social and emotional development. When we're talking about kids, sometimes it's called social and emotional learning. And if you follow the workplace field, you will see more and more articles coming up about the role of emotional intelligence. And they're not talking about it in the context of health and safety. They're talking about it in the context of workplace performance, and in particular, leadership development and team development. So previously, I was just showing you an article from Fast Company. Here's another article that's coming up from Inc. Here's an article that's coming out of the Harvard Business Review. So just all sorts of places where this idea of emotional intelligence and its role in the workplace is coming up. But as you all may well know, emotional intelligence is not just something that is related to the workplace and is related to performance or leadership. Emotional intelligence and social emotional development are heavily associated with improved health. Improved health among youth, but also improved health among adults. So these are just some meta-analyses that I tried to pull up and some other research that comes up around the relationship between health of social emotional development and improving health among adults. And so there's a strong connection here. And this is a great opportunity for all of us working in the health and safety field, because not only is social and emotional development associated with improved health and safety, it's also associated with improved workplace performance. So there's more and more research coming out showing the relationship between increased leadership skills, perceived power, increased organizational effectiveness, and improved work outcomes. This research is not by any means just in the United States. Actually, there's a lot more of this research going on in other countries, Australia, European Union, Great Britain, all over. So there's a lot of work. Often in the workplace, it's not called social emotional development. It's often called emotional intelligence, EQ, different things like that. But I think it's a really cool future opportunity for us, because if we just think about social emotional development, we know that that is a core element of many evidence-based prevention programs. I mean, if you look at school-based programs that are trying to reduce the misuse of substances or violence, or seeking to mitigate the issue of ACEs or improve mental health outcomes, much of that is grounded in social emotional development work. So it's interesting for us to leverage what we as preventionists know is a core element of school-based efforts and curricula-based efforts to improve health and safety. We know that that impacts health. It also improves learning outcomes for kids, but it improves health and safety not only of children, but also adults. But we can also connect the dots to increase productivity in the workplace. And so now we have a tool and a mechanism to talk to workplaces which can, in a way that can absolutely impact their bottom line in terms of improving productivity, but also improving their health, which also improves their bottom line, but in ways that they may not be able to measure as directly as they can issues like productivity. So I encourage you to continue to learn about social emotional development. Think about it through the lens of the work that's already going on, that you're using in your strategies to improve health and safety, but also how that connects and how we might be able to leverage that and its impact on increased productivity to get in the door and help workplaces be more effective. So what are some potential next steps that we might think about in this work? So I think without a doubt, going back to the way that you all answered that survey at the beginning, I think we should begin at the beginning, which is within our own circles of influence. And how do we build better prevention strategies into our current workplaces? Do we, as individuals who advocate for health and safety, are we talking about that as a critical role of our own workplace? Do we raise that with our leadership and ask questions like, do we have a distracted driving policy? What is our policy about driving after drinking? And how do we start to address aspects around violence reduction by bolstering social emotional skills and some other things? So let's, I think, begin in our own workplace is a great opportunity. I think we need to start asking about health and safety related workplace policies. So if we're doing community assessments, if we're doing any kind of our work that we might do to assess the state of health and safety, we need to start asking more and more adults about, hey, do you have a policy on this? When was the last time that policy was revised or updated? When was the last time that policy was discussed or trained on? Is it enforced? And I think this is just by asking those questions, we can start to raise and highlight those issues and make that a part of how we do our community assessments. I think we absolutely need to start educating business leaders about the costs of poor health and safety. They are paying for that. They don't write a check directly for it, but they write a lot of other checks to other people for it. And a good example of this is in Utah, when Utah went to change their seatbelt law from a secondary law to a primary law. They engaged workplaces in that dialogue. And the workplaces were the ones who went to the legislature and said, we want a primary seatbelt law because the secondary seatbelt law is costing us a lot of money in our liability insurance and other forms of insurance. So when the legislators heard the workplaces wanted this as a competitive advantage, that really started to help change the conversation. And I think we absolutely need to continue to learn about social and emotional development in a variety of contexts. We may know about it in the context of health and safety with youth and curriculum-based programs, but how can we tie that into what's happening in workplaces and teach workplaces about this tremendous opportunity and seeing how they can bolster their productivity and at the same time grow protective factors around a variety of health-related issues. So I think my big picture is to come back to the joke and say, yeah, even though the light may be better, I think we need to shine a light on workplaces and create that as another illuminated area that we can have profound impact on health and safety and avoid the fundamental attribution error and not just focus on inoculating kids, but really work with adults too, so that we can create more and more environments where healthy children can grow into healthy adult environments. So that was a fair amount of material done very quickly, but I want to come back and just quickly share some other things that are going on in the broader context of the center. Here's some upcoming webinars. I'm also going to send these out to you in an email tomorrow. That'll be a follow-up to this webinar, so you'll get those in that email as well. But know that there are some other exciting topics that are coming up, so you can absolutely go back to our website, which is listed up there in the corner, and sign up for those. You can also sign up for a quarterly e-newsletter. The next one will be coming out mid-November. We are contemplating another open positive culture framework training. We just had one a couple of weeks ago. So we're contemplating one in 2019. And we're thinking about planning our next symposium. We had one this year, and we're thinking about planning our next one in 2020. I'll just leave this slide up. These are other services that we do. I would encourage you to feel free to type in any questions or comments to the chat box or the question box. I can see those directly on my screen in front of me. We can also have other staff members who can see those, so feel free to text in any questions. I also got a message from a colleague that I guess the president decided to interrupt my presentation with an emergency text alert test. So that was kind of a bummer in terms of timing. I hope that system works. Obviously, that system is a great prevention tool, so I don't want to discount it there. But it's all in the timing, right? So hopefully that didn't interrupt your flow too much. But feel free to text in any questions or comments about this topic. I don't think that there are any silver bullets or magic ways to get workplaces involved. I think it's similar to the way that we probably all work with and engage schools, and that it's all about relationship. In that it's going to take time. We have to build relationships. We have to build trusting relationships with workplace leaders to help them see these roles. They too have a lot of issues on their plate. Profitability is number one. So I think it's interesting for us to take the same approach that we use to engage schools with workplaces, and that's long-term relationship. But I think it's important for us to get out and start to meet those folks, be in places where they are, go to chamber meetings, other things like that, and start to bring this kind of information. You can also feel free to follow up with us later on. And I encourage you to think about joining any of the other webinars in the future. So I will just leave this last slide. If you want to follow us in any ways, we're on various forms of social media. So feel free to follow us in any of those ways. We will send out a follow-up link, and it'll be on our website once we put this recording online, so you could listen to parts of it or share it with other folks if you wanted them to watch it as well. I think with that, we'll wrap it up for the day. I hope you have a great day, and take care.